During an emergency meeting at Mpilo Central Hospital to address student nurses on the preventive measures against COVID-19, students stated that they needed protective clothing and demanded the presence of qualified nurses in the wards. In their plea, they said if there was no protective clothing or supervision, they would self-quarantine as they were not immune to the virus. However, in his response, Dr. Solayo Ngwenya said they should be aware not to self-quarantine out of employment.
We have families there. We are going to live here. They will take that infection from their families.
And they are coming back to us.
What is your solution?
I don't know. Let's come together and come up with a solution.
Not to threaten us.
That are threatening people's lives.
This video clip was recorded during one of the meetings that the students had with Mpilo authorities, where they were expressing their dissatisfaction and demanding fair treatment.
So I'm a student nurse from Mpilo, and we are being forced to go. We are forced to go to work without protective clothing. When we addressed this issue with the CEO today, he threatened to fire us. He said that we begged to come into nursing, and they never asked us to come to. They never knocked at our doors for us to come to nursing. So if we continue saying that we want protective clothing, or else we want protective clothing, or we are withdrawing our services, they'll fire us because we have no choice than to go to work.
The main purpose was not to address the issue of students working without PPE, but to threaten students, I think. Because as a leader, you are supposed to at least listen to what we were complaining about. At the moment, if you go to the wards, you will discover that the people who are working in the wards, they don't have any protective clothing. It is just some masks, which are actually considered to be fashion items, not really safety precautions against this COVID-19. At the end of the day, we're just going out there unprotected.
This escalated students' tempers as they said the response was a threat to their jobs and could not tolerate such treatment from the higher office. Amakhosikazi Media caught up with the public relations officer from Mpilo Central Hospital, Mr. Ozias Ndlovu, who said that all students working in the high exposure department were given protective clothing.
There are departments we are saying these are high exposure department. So all those who were working in such departments, they were given the protective clothing. And though as a country, as a ministry, we have got a challenge with the PPE, but we have received some from head office, and currently those who are on duty, they use some of the PPE.
Despite the sentiments by the public relations officer, according to the students, the total number of protective clothing available does not tally the number of employees available at the hospital. The workforce in the health sector is highly exposed to the coronavirus, hence an urgent need to acquire protective clothing. As a preventive measure, the government has announced a 21 days lockdown starting on Monday, 30 March 2020. Binenhle Moyo reporting for Amakhosikazi Media in Bulawayo.